Good morning, teacher. My name is Maria Fernanda Madrigal, and this morning I will talk to you about the cystic fibrosis. How introduction I will be to start by mentioning on the following points: genetic disease, attacks the lungs, and diagnosis in adults and children. Some of the objectives that this presentation is analyzing, for example, are general objectives. In this exhibition, knowledge about the origin, a proper handling will be discussed for all people, children, young people, adults, and families. Thus, life conditional is decisive fibrosis. Specific objectives: to learn about the diagnosis of the cystic fibrosis, to identify the presentation of the disease, mention the proper treatments and appropriate measurement for people with cystic fibrosis. To ground. What is the cystic fibrosis? The cystic fibrosis is an inherited disorder that causes serious damage to the lungs, digestive systems, and other organs of the body. How could a person get a cystic fibrosis? Well, this is because the patient in his life was a candidate to suffer from one of these 3 points: heredity type, chromosome number 7, and it affects various organs. The patient with cystic fibrosis may have a following symptoms: more viscous and elastic mucus, airway obstruction, and coughing and wheezing. Pathogenesis and diagnosis: canal involvement, alteration in the secretions of the bronch, viscosity increase, and the mucociliary variation, neonatal screening, treatment effectiveness, technological and scientific advance. Some of the tests to diagnose cystic fibrosis are sweat-proof. They stop in share with pull-up substance of the patient arm and substance that will help with sweat, and this sample can be collected to see in their IHAL levels, chloride in the person's body, illness with a high level of chloride in sweat, control digestive problems, and family history of safe pathology. Another test is the National Potential Difference Test, PNT. In this test, an applicator will be introducing the nostrils to obtain a sample of the chloride concentrations in the nose by means of the electromagnetic pulse, and if the values are less than 40 millivolts, the patient with cystic fibrosis will be diagnosed. Gene alterations, easy of the testing, and false positive. Background. Cystic fibrosis emerged many years ago, known as the Cystic disease. This is a mexical link. Treatment. Drug administration, nanoparticle assistance, control the mucus retention, and infections. Phenotypic expression in patients with the cystic fibrosis. Cystic fibrosis was known in Costa Rica. In the HNM, there are a large number of the people affected by this disease. Most frequent symptoms: hospitalization, diagnosis, and mortality. In conclusions, the care of a patient with the cystic fibrosis, this is more complex than another patients, so these are some recommendations. Health center recommended that newborns should be screening, neonatal screening, patients suffering from the cystic fibrosis are recommended to do physical exercise and recreation activities to improve your conditional, and patients must have a very strict control with their medication and vitamin supplements, and the doctor prescribes. Patients with this disease are advised to maintain a very healthy diet balance and avoid space the smoke of the polluting environment as they can harm plus the lungs. And this is the end for cystic fibrosis. Thank you.